My pleasure to introduce tonight's host, Dr. Samin Zarabi. Dr. Samin is going to say a few words, welcome you, and get us started. Dr. Samin, please take it away.
Thank you, David. Hello, everyone. Thank you for attending. My name is Samin Zarabi, and I organize a study club in San Diego. So special welcome to the members of our group that are here tonight. And I also like to welcome the other members of this meeting this evening. I'd like to say a special thank you to our speakers, Dr. Lau and Ms. Valerie Dangler, for sharing your expertise tonight. We're all looking forward to learning some things, especially with post-COVID strategies. I think we all could use some help with that. So thank you very much to you, David, and to BioLace for making this event happen for us and for the CE course. And I'll turn it back to you.
Excellent, thank you. If I could hit the unmute button with any confidence there, Dr. Samin, I would have followed that right away, but thank you very much, yes. And so without any further disruption, I'll get to the intro and bios of our speakers. They're both very accomplished and their bios are quite long, so I'm sure they'll forgive me if I truncate those slightly. Our first speaker, Valerie Dangler, RDH, is an enthusiastic and passionate dental healthcare professional with an established reputation of leadership and results, particularly around education and sharing her passion for hygiene with those all around her. Valerie has spent the last 26 years in hygiene, having served really in dentistry, having served as assistant, office manager, and of course an RDH as well. She is responsible for the training and development of dental teams, implementing several new product innovations, not only here with BioLace, but also with Align Technologies. She is a KOL and speaker for both of those. Valerie graduated from Northern Arizona University with a Bachelor of Science and also received a degree in dental hygiene from Rio Salado College. And she's licensed to practice both, I should say, in 3 places, Arizona, Utah, and Georgia. She's quite involved with hygiene leadership and was past president of the Georgia Dental Hygiene Association. It's really our pleasure to have Valerie with us this evening. And our second speaker is Dr. Sam Lau. I should know Dr. Sam's bio by heart, and I will shorten it just a bit. Dr. Sam, please forgive me. Dr. Sam is an emeritus professor at the University of Florida. I think he's actually speaking to us from there at the faculty practice tonight. He's heavily involved with the perio community as a past president of the American Academy of Periodontology. He's been recognized nationally by the Gordon Christensen Foundation, among others, and is past trustee not only of the Florida Dental Association, but of the ADA. So it's my pleasure to welcome both of our speakers, Valerie Dangler, Dr. Sam Lau. I believe, Dr. Sam, you're going to lead us. Take it away.
Well, thank you, David, and I really appreciate everyone in all time zones. Valerie and I are on the Eastern time zone, so if you give us another couple of hours, we would be fast asleep while we were still doing this webinar. But no, we're both excited. She and I are passionate about our professions, and I think it really demonstrates how teamwork can occur when you have dentists and hygienists working together with the same type of theme. And that actually really comes to play as we talk about this whole arena that we've been through with the pandemic. I'm just going to spend just a few minutes to set the stage of really where we are and what this is about as far as both hygienists and both as dentists. And then I'm going to turn it over to Valerie to really get into the brass tacks from the hygiene perspective relative to strategies with the vent on lasers, primarily the diode laser. Then I will pick it back up at the very end and discuss with you the all tissue lasers. We have learning objectives for you. One will be to take a look at some best practices, industry guidelines, however those continue to change on us. I think one of a focus that we will both have will be something about the aerosols. One area I know we will both have will be minimally invasive and what our patients expect right now. And the bottom line still is going to be what is the return on the investment for both the diode and all tissue lasers, because the billing and coding becomes very intriguing when it does deal with laser arenas. If you look at the pecking order as far as aerosols go in dentistry. One of the areas, I mean, you're looking at red and to a certain degree caution, and then down at the bottom, what really always sort of comes to the top is two things that produce aerosols. And one is your powered scalers, and the other is the high-speed handpiece. Now, given that some of this data is old, and I think Valerie would even agree with me that the way you use a powered instrument like an ultrasonic, you can get a lot of aerosol, but that's some of that has to do with you and not necessarily the device. But be as it may, the bottom line is we've reached a point to where if you look at this, and if you haven't seen this, I promise you it's been circulated around, and it's called the COVID-19 Occupational Risk Score. And you'll see over on one vertical axis is the money, and on the other vertical axis is going to be risk. And if you look at the arrows there, I can suggest to you that some of the two top arrows of all occupational risk score happens to be Valerie and I. And you and I could debate on how they got that data. But the bottom line, most regulatory entities still look at this particular. I mentioned once that in January of 2020, I couldn't even spell aerosol. But I must tell you that I wake up with aerosol, I go to sleep with aerosol. I don't think any of us would ever want to hear the word aerosol ever again. And as you know, we got into, I mean, it's become almost absurd. Is it splatter? Is it droplets? Is it aerosol? If it's on steel versus copper versus plastic, the bottom line is you're probably aware, I am aware of some people that still haven't left their home in the last 6 months. But be as it may, there's really only 2 studies that have had really any emphasis on this. And actually, the one that's still quoted is the Herald study of 2004. And we still use it to today, even through this COVID-19 scenario. And you'll notice that it says about universal barrier and pre-procedural rinse and HVE. And guess what? If you look at where we are now, and we look at this Chinese study, it is the second most quoted study in transmission routes of COVID-19. I must tell you that it says the exact same thing as the 2004 study did, which suggests hand hygiene, personal protective measures, mouth rinse, etc. And so I look at the trifecta in all of this, and I still maintain it. I began to lecture on this in March, and you fast forward now to November, and it really comes down to 3 areas. Pre-rinse, and my goodness, everybody and their brother and sister has created a new pre-rinse that has happened here in the last 6 months, whether it be iodine, whether it be hydroperoxide. But let's face it, some of us were doing pre-rinses before pre-rinse became important. The other in the trifecta is the way to reduce the aerosols, and that be decreasing your water, etc. And then lastly is the HVE use. And with that has become some very creative things for both dentists, hygienists, and periodontists. This is something that Nancy Miller created for Hugh Freedy. But it really comes down to getting the device, your HVE device, as close to the etiology as possible. But throughout all of this just came out today. And if you had the pleasure, I hope you are, there's probably no other creating more objective data about where dentists and hygienists are in all of this. And for the last few months, and I'm proud to be an ADA member, has been the American Dental Association and its consistent surveys almost at least every 2 to 3 weeks. So this just came out. So if you look at this, the question of the week was, in an effort to reduce aerosols, how has your practice's use of the following changed compared to before and now the COVID-19 pandemic? And you will notice that at the very top it was hand scaling. That had the most significant change, and you looked at there's 66%, 2/3 of the practices are doing more hand scaling than they ever have. And then you see the silver fluoride, the glass ionomers, fluoride varnishes, and the sealants. Along with all of this, it's created, and Valerie will probably discuss this, it's physical and mental stress amongst our hygiene team. We've seen a fairly significant decrease in hygienists coming back to work. And so, but also with that, and this is the periodontist in me, is this very interesting dynamic between the comorbidities of COVID-19 and the comorbidities of periodontal disease. This has been validated by a couple of studies, one in the British Dental Journal and the other in the California Association Dental Journal. And what it's suggesting is if you put the comorbidities back to back of COVID-19 being cardiovascular disease, diabetes, you're probably aware that in the last 2 weeks, obesity has come almost up to the top, especially when we're dealing with respiratory diseases. These are almost identical to the comorbidities of periodontitis. And so what it suggests to us is actually both of these conditions are truly inflammatory conditions. But the bottom line for us from a periodontal standpoint is how are we going to manage it? And that also creates the entity of, from the standpoint of patients. I must tell you, one of the other things that occurred with the survey today is we're starting to flatten out again. There was this pent-up demand in June and July, where in Q3 our numbers were actually rivaled 2019 Q3 numbers, and actually in some areas were more, but that was this pent-up waiting to come back and see us. So as they say, the petal has sort of fallen off the bloom now, and you're starting to see some hygienists not as busy as they were before. And this may begin as we continue to actually have even possibly more lockdowns. But to also tell you that one thing that the ADA has done this time, and that is to demand that dentistry be essential. If we had done that back in March, April, we probably would not have had the issues that we did have with dentistry. So as I begin to close and open this up for Valerie, from the hygiene perspective, the bottom line is whether you're a periodontist, hygienist, pediatric dentist, the bottom line is our patients are wanting minimally invasive procedures. They're wanting that more than ever. Our patients are becoming much more holistic than they were in the past. They're not wanting chemicals. They're wanting to keep their own teeth, etc. And that brings us to our passion, and that is laser. And the one thing that I would leave you with is a laser is not a laser is not a laser. Our lasers are totally dependent upon what you want the laser to work on. I'm sure Valerie gets this question too, but about every 3 or 4 or 5 days, someone calls me up and says, Sam, I want to buy a laser. And what would you ask them if they said, I want to buy a laser? What would you say to them? Well, I would probably say to them, well, what do you want to use it on? Many times they'll say, I'm not really sure, but I know I want one. Well, if you're selling lasers, that's music to your ears, but you would sort of like them to know what is about. And it is about wavelength. And you just cannot defy the wavelength. If you want to work on implants, you can't use diodes. But if you want to try to create hemostasis, then you want to use a diode. So we're going to go through some of these things with you. We're going to have what we call pick your wavelength, but this is biblical. There's not a laser program ever done that doesn't show the absorption coefficient of and transmission of lasers. And the bottom line for us is that if you're going to be in the diode spectrum, it's hemoglobin and melanin. But if you're going to be in the all tissue laser business, for teeth and roots and bone, then it's going to be the erbium business where you see it peaks out at water and hydroxylapatite. So with these lasers, we have our diode lasers, and they're wonderful. They cut, they coagulate gingiva. They're just excellent for precision. In some situations, you can do topical anesthetic. For frenectomies, they're wonderful. They're a little slow for my taste, but you can do them. The precision is great, but you know, the one thing that we still have not totally figured out yet, and that is why there is such a substantial decrease in postoperative discomfort, and also on the opposite, such an increase in accelerated wound healing. So they're bactericidal, they deepithelialize, they do gingivectomies, and my goodness, look at the things they can do. From lesions 1 month with no suture, aphis herpetic lesions, here 48 hours afterwards. And so gingivectomies, this takes probably 3 seconds and gets no hemorrhage and just fantastic healing. Frenectomies, even whether they're done with diode or all tissue laser. And again, just a perfect diamond eliminating this situation, especially even for a partial or a denture patient. So with that is my sort of, let's get started. I'm going to turn this over to Valerie. I'm going to put this into the hygiene operatory, and what are the areas that, Valerie, that we can use lasers with in your repertoire, from perio, etc. So I'm going to stop sharing my screen and turn it over to you. You're on mute.
Yes, you are, Valerie, but I can step in the interim while you get started there and just make sure it's nothing that Zoom is doing to you. Hang on 1 second there. And that might be helpful. Let's see if that's better. You have a lovely smile, and if I could read lips, I would tell everyone what you were saying. Just not at the moment. So you might want to see if you can unmute yourself on your end, Val. Or Sam, you can just continue on for another 10. There she is. All right, okay. Yay. Thank you, Val.
Thank goodness. I was going to have to start doing Valerie's presentation, and I know I could not do it as well as her. So Valerie, thank you. My blood pressure now has gone back down to 70.
Excellent. Glad I could help. All right, so let's go ahead and get started here. So you guys are taking a look here. You can see my presentation that's now up on the screen. Is that right? Did it not share?
Not quite yet. Might just be coming up. Sometimes there's a little bit of a delay in what we see. There it is.
Is it up now? Great. Okay, great. Well, thank you guys again so much for joining us and for having us here this evening. Great job, Dr. Lau, as usual, to get us kicked off and really look at what we are doing with lasers in the practices. I'm going to, as he mentioned, speak more to the hygiene arena. So just to get a little started, here's my disclaimer. I'm an independent consultant speaking tonight from BioLace, that the statements here are of my own. And basically that, as a viewer, you're responsible for any legal or regulatory compliance associated with any recommended actions, marketing, referral programs, and the laws that govern in your state, including lasers, will vary state by state. So it's really important that you take a look at your local state boards and their practice acts, and know what hygienists can do, because it does vary from state to state. A special thank you again to BioLace for hosting this tonight, and with the World Class Laser Institute, and of course, the San Diego Pediatric Dental Study Club. So thank you all for putting this together. So I don't need to go into the introduction about myself. David did such a great job introducing me. These are just some pictures of the things I do. I stay very active, as he mentioned, in the hygiene arena. I've been a laser certified hygienist now through the Academy of Laser Dentistry for 17 years. And so, it's one of those things is once you've used lasers, it's so hard to go back. I've seen the wonderful things that it's done for patients. And so I'll be able to share a little bit high level on the short amount of time that I have with you today. But to see here, this is my family on the lower left-hand corner. Those are my boys. And then you can see all the other things that I do there to stay active. So to get started, I was able to see some of you all in the chat box that David put together. I'm going to ask that you guys first take your phones out. And if you want to play along, you go ahead and just take a picture of the QR code that's on your screen. It's going to pop up and may ask you your name. If it asks to insert for the poll everywhere, you use my name here. And then you'll be able to participate in our live polling this evening. Okay, so I'll give you guys just a minute to do that and we'll go to the next question. So what city are you from? In the chat box that David put in, I did see that we had a few people from Virginia, Florida. Thank you guys so much for being here. I know it's late and that just shows your dedication to our profession. So looks like we've got a lot of people from the West Coast joining us. I did see somebody internationally on here as well from Indonesia. Thank you for joining us. I have no idea what time it is for you over there. But again, we've got some great things coming in. Wisconsin. All right, great. Wow. Lots of great areas all over. I mean, all over, not even the country, but it looks like, again, some international participation here. So we're so glad you joined us tonight. All right, the next question here is, what is your role in the office? Are you a hygienist joining us tonight? Are you a dentist, an assistant, office manager, treatment coordinator, office administrator? You guys wear so many hats. So please let us know who's joining us tonight so we know who our audience is. Excellent. Looks like so far with the results that I've got in, we've got about 44% hygienists, 56% dentists. Joining us tonight. So good representation of both hygiene and dentists joining us tonight. Excellent. All right, so course objectives. Now, Dr. Lau did go through these already. Again, I'm gonna just speak to the level of diode lasers and hygiene and what that looks like as we incorporate procedures into the hygiene operatory, what we're able to do to control aerosol management, since that is something of importance, and then give a little bit high level on what is the billing and coding strategy specific to diodes in hygiene, and then what does that ROI look like for the practice? So that way, doctors who are on today, you're looking at this and you want to incorporate diode lasers into the hygiene program and have your hygienist start utilizing lasers, we'll definitely be able to share some case studies with you as well. So we've all been impacted, right? So we've all been impacted by COVID-19. I remember the day that March 11th of 2020, when the World Health Organization declared COVID-19 a pandemic, right? And by March 16th, our practices were closing. And the AD had made recommendations that, to close the practice and only have that emergency care. And so our doctors were really faced with challenges. I work with so many doctors as an educator and a consultant around the country, and speaking to them, it really was hard for them to have to come up with the decision is, what do I do? Do I have to furlough my team? Do I lay them off? So they really were doing their best, having to deal with everything that's going on, the PPE loans, the CARES Act that was all the information that was coming in with the pandemic, and doing their best to still get into the practice and practice safely for those emergency patients. So just a lot going on, not only, for us as your auxiliary team, but we really truly understand for the dentists out there, all the things that you guys have been faced with. The daily news was haunting too. I mean, with those of us that were at home, just watching the news, it became haunting, and it also was frustrating because one day we'd hear one thing from the CDC to do something this way, and then it was it would change the next day, right? So, and we're still getting a lot of that as we're learning more and more about the virus. And I'm excited that we're finally getting, more and more advancements with some research that they're doing now and what we know now to help us in practice. So as we came back in May, some offices opened up in May, while other states were just reaching their highest numbers. And where I was ready to go back, I was speaking to hygienists on the West Coast, and they were just shutting down because their hospitals were overwhelmed and the numbers were high. So again, dealing with the flooding hospitals, and we're starting to see that second wave now that's going on here too. So all the things that we've been dealing with, right, the last 9 months now. On August 12th, the World Health Organization came out with a statement as times were not bad enough. And what they said is that, they recommended additional delay of dental care. So here we are ready to go back. Now we're like, wow, just when we're getting some sort of norm, we want to get back and take care of our patients. Now this went out on mass media. And so I was really proud of the ADA, the American Dental Association, the president, Dr. Gahani, who really declared us as essential healthcare. And I think Dr. Sam spoke to a little bit that earlier. So I'm excited, and I hope that this continues because we are essential, and we know with that the comorbidities and that relationship with the oral systemic health, we really need to be in there caring for our patients. So here's the impact that COVID had on hygienists. The hygienists that are on the call, the 50% of you today. Does this sound familiar? A lot of things that you're reading here. I got a lot of these statements from an article that Dr. Bicuspid had put out on a survey project that was called RDHs in the Real World. And I saw firsthand going to many of our Facebook forums and other types of forums that, just again, the hygienists were emotional, very emotional. Coming back, the experience that they were sharing on social media as they returned to the office, it was hard. It was hard for me to read. I remember the first patient I saw in May coming back with that N95 mask and not being able to breathe. And with that first patient having sweat coming down my face and, having the marks around the face from wearing the N95. And so there was an adjustment period for sure. And, putting all those protocols in place. But, unfortunately, what happened also is a lot of our hygienists and other auxiliary team members decided not to come back because they didn't feel the uncertainty of not feeling safe, right? And not knowing if they had adequate infection control procedures in place. And so it's really, really important that, many of you have already taken these actions in place, but there are practices, a lot of hygienists I speak with that are temping and they're going in there and these practices and these changes are not in place. And so safety continues to be the most critical issue in our profession. As Dr. Lau showed, it's at the top of the list for risk. And so hygienists are scared and safety is the number one concern. I also feel, and I know that if it's done right, dentistry can be one of the safest places in healthcare, right? I mean, if we're doing it right, we've got the proper standard precautions, infection control and PPE in place. With one of my practices, we've got the UV lights, we've got the air purification systems, we have our N95 masks that I even wear a surgical mask over to protect it, the face shields, the surgical caps and gowns that we're changing in between patients. And then, the pre-procedure rinse. Luckily, I've always done a pre-procedure rinse. I was taught that in hygiene school, and even as a hygiene educator, when I went back, we still did that. My first practice I worked in Sun City, West Arizona, we used Closest at that time as our pre-procedure rinse. So it's really great for me to see now that dentistry's getting it, right? So we've got things that we should have maybe already done before. We kind of have this universal precaution now that we are using more of a pre-procedure rinse, and also now with lasers. We're using LBR, that laser bacterial reduction. A lot of offices have incorporated that to help mitigate the risk for dental aerosols. All right, so again, looking over here at, aerosols as a key topic, as Dr. Lau had mentioned earlier, there's been a lot with Cavitron, right? So certain states were actually mandated by their governor that they were not allowed to use Cavitrons. And so that was hard for hygienists with increased hand fatigue and things of that nature. Some offices have gone back to aerosols with all the advancements that we have now with HVE systems in place. And like I said, with the air recirculations that have the HEPA filters, the UV lights, and things that we can do to help recirculate the air. One thing I really want to hone in on is, those that are still using mostly the hand instrumentation, we have to make sure that those instruments are sharp. Right, hygienists, because if they're not sharp, you're going to have increased hand fatigue, potential for carpal tunnel. So definitely make sure that you're getting instruments, if you're continuing to use hand scaling as part of your practice, that you're getting a lightweight, larger diameter handle to help you reduce that fatigue, and that they're sharp so they'll actually do a good job for our patients. The other thing here was scheduling. So scheduling, not enough time for us to have optimal care. And so those expectations of working at the same pace while we were doing all these extra things, and we were not having time to turn over the room. So, again, those are some best practices that have put in place, is allowing more time for the hygienists and or other procedures to have these safety protocols in place. All right, so here's Poll Everywhere. We're going to do another quick question for you guys. If you need to take a picture again, go ahead and do that. Great, and let's take a look. Are you currently using ultrasonics? I'm going to clear this. Are you currently using ultrasonics in practice? Okay, we've got great results coming. So it looks like a lot. This is, from other webinars I've done during this pandemic, I've seen this shift actually tonight. So it looks like more offices their hygienists are utilizing ultrasonics, and we are still doing, there's about a third of us here that are still doing hand scaling only. Interesting. Okay. The next question here, are your hygienists in your practice, are they using diode lasers? Again, great representation of, we've got about a third, 29% that are currently using diode lasers. So that's excellent. Feel free to send in any questions you guys have that you're struggling with currently in your practice. And for the other 71% not using lasers, we're going to be able to give you some great information going forward here. So with crisis comes opportunity. And I'll tell you, one of the things I'm so proud of our dental community is how we've come together as a dental community and an industry, and all the evolutions, I should say. There is a silver lining. We were quick to adapt and evolve. Coronavirus really had been a catalyst for us as a healthcare revolution. And what we were seeing, increase of teledentistry, virtual platforms. We had to do remote monitoring for our patients when we were shut down, and now we continue on that path. The infection control protocols that have been put in place, and paying attention to those water lines. Like Dr. Lau said, the word aerosol was not in the vocabulary, and neither was OSAP with water lines. And what we know now with having to really take a look at our water lines and our poses and everything in the office. Paperless technologies. We've now had to go from, texting our patients out in the waiting room and having them come in and try to do everything with a QR code and remote pay and scheduling. So again, incorporating the technologies that we've had to do over the last 9 months. You can see here on the bottom, this robot. This is a robot with UV lights, incorporating, again, those purification system. And then above here, something that's really great news, that there was an independent lab test that showed that closest ultrasensitive rinse, it reduced the SARS-CoV-2 COVID-19 virus up to 98.4% in as little as 30 seconds. And so again, me having a product like this that I've been using for years as my pre-procedural, I can feel confident going in that I'm helping reduce and mitigate that risk. Adding the laser on top of that for LBR to help mitigate risk is really giving our practices and our patients peace of mind. So here's where we really need to come together as a dental community. Dr. Lau, as a periodontist, I'm sure he loves this, I would think, with that oral systemic relationship. He talked about the comorbidity, right? And all the same risk factors that we're seeing for COVID-19, we're also seeing it are the same with our perio patients. And so we've seen these research articles now come out, the British Dental Journal and other things that are coming out and really not only helping our dental community connect the dots if they weren't already, but it's letting the media, letting our consumers, our patients know. So now our patients are coming to us and they're asking about this. They want they want to come in, they want to take care of any type of oral infection, that they're finally getting it. They're finally getting it. And so we really have an opportunity here to showcase what we do as prevention specialists and also assess and provide therapeutic treatment for inflammation for our patients. I've noticed patients coming back because they're so overdue. Some of them haven't been in for 9 months. A few I've seen, it's been a year because they may, the way that they're just now getting in. And so they're coming in with inflammation. We've seen some cracked teeth with all the stress that's happening, right? And so it's really our opportunity now to educate our patient and dentistry to really be looked at differently as oral healthcare professionals that we are. So here we are as an opportunity. Again, hygienists, we have an opportunity here. We know the statistics show us 47.2% of adults aged 30 and older have some sort of periodontal disease, right? And that increases at the age of 70, right? So, I'm sorry, at 65, that increases to 70%. The ADA even notes that 87% of patients are be treating as a prophy. So if our statistics are showing that our patients have gum disease, but yet what we're showing we're doing is mostly prophies, we need to stop. We need to stop doing bloody prophies. We need to look at our patients, assess them, have that conversation. Many of you are having these post-COVID, as Dr. Lau also mentioned. We had an influx and our schedules were full, and now we're starting to see them teeter off a little bit. We have an opportunity. These patients are coming to us inflamed, they have infection. Start treatment. We can start treatment same day. We can combat their infection, treat them. So that way we're actually doing the care that they need and bring down that risk for not only their periodontal disease, but that whole oral systemic connection. So luckily, another thing that happened during our shutdown is BIOLACE received FDA clearance. And I think this happened, it was like perfect timing, this past March. So they are the only hygiene laser. This is called the Epic Hygiene. It's the only hygiene laser that's been FDA cleared for laser bacteria reduction that has been for hygienists, designed by hygienists. It's got a 980 wavelength, and it's great because there's a difference in the price point with this, so that your hygienist, if you have multiple hygienists, we don't have to have them share their diode laser. They get one in each of the hygienists gets them in their operatory. If they have to share, it's just not an effective and an efficient way to have a laser program. I've seen it firsthand as I've worked with multiple practices. And so kudos to BIOLACE for making this more affordable so that we can get this in the hands of more hygienists. So I'm going to quickly just go through what we can do in hygiene, and then pass it over back to Dr. Lau here in just a few minutes. So why lasers? Again, the AAP, the guidelines emphasize that periodontal health should be achieved in the least invasive and most cost-effective manner to the patient. And so as hygienists, as prevention and perio specialists, inflammation specialists, we can offer the patients a non-surgical approach with non-surgical perio laser therapy for patients, and give them that state-of-the-art care, right? And I want to remind you guys definitely to check your state practice acts as I go over and show you the different procedures that hygienists can do with a diode laser. And again, just remember to check your state practice acts. So here's some of the applications that our hygienists can do with lasers. You can see here LBR, laser bacteria reduction. We can do laser-assisted periodontal therapy, aptus ulcer herpetic lesion treatment, hemostasis, dental pain therapy, help with the treatment of TMJ, tooth whitening, desensitization. So these are some of the applications used specifically with hygiene. When we look at, when you've heard, 71% of you on the call today are not currently using lasers. So you're probably saying, what is she talking about LBR, right? So LBR stands for laser bacteria reduction. And again, this can be done preventatively as a pre-procedural disinfection that reduces the biofilm and the viral load to help mitigate that risk for bacteremia and potential viral loads in the aerosols, correct? So it could be used for that, but it's also used as a procedure, a decontamination for inflammation. The result we get with LBR for our gingivitis patients, we have the laser-assisted periodontal therapy, LAPT, an adjunct to our scaling and root planning. It's more of a therapeutic in nature. We use this to treat gingivitis as well, inflammation, and also periodebridement. During LAPT, there are states where hygienists are allowed to curettage, and at that case, they can go ahead and do that sulcular debridement by removing that epithelial and granulation tissue, similar to what we were taught in hygiene school to curettage with reversing that Gracie, right, to get that granulation necrotic tissue off. So some states do still allow that, and in that case, we can use our diode at a different setting to achieve that result. And then finally here you see PBM, and that's a photobiomodulation, which is a low-level light therapy. We use this for things like aptus ulcers, the treatment of herpetic lesions, again, to provide that hemostasis, and TMJ therapies. So here's an example of what we do with a herpetic lesion. And what we can do here is use it in non-contact mode. We just stay a few millimeters above the lesion. It takes, just a few minutes and the patient leaves. Dr. Lau showed some pictures within 24, 48 hours. I mean, I have patients that give me feedback that immediately that throbbing pain that they get in that prodromal stage, that throbbing pain, it subsides and it starts crusting over. So typically we'd send them to the drugstore, we'd give them a prescription, they would use acyclovir, whatever. It would, you'd get more, of the vesicles, and it would take about 2 weeks. It'd be very, very painful. So you add this to your practice, your patients are going to love you because no one likes to have that on their face for 2 weeks, but it is very painful. And so it's also a great practice builder. Whitening is another thing you could do. Here's an example. This is the Epic X that has the pain therapy attachment and the whitening attachment. You can see the pain therapy here where we can stimulate the cellular function and activate the mitochondria to release the nitric oxide, which increases the vasodilation and really helps create that anti-inflammatory effect. Promotes for wound healing and everything else that we can do with these low-level lasers utilizing the diode system. All right, so let's get to the ROI opportunity. I know doctors, you're thinking, okay, great, this all sounds good. We want to learn more, and in order to learn more, yes, there'll be courses available. That we can give you some information on at the end of the program today. So how is this ROI going to help you? Well, as I mentioned earlier, the prophy is still the most common dental hygiene procedure. So we have an opportunity to look at our patients and treat the inflammation, treat the infection. We can do that by looking at our periodontal percentages. If you don't know how to figure out your periodontal percentages, email me. I'll give you the formula. I'll help show you how to do that. Okay. So what we want to see is that 40 to 60%, and 40 is on the lower end. I mean, if you speak with most consultants, they're going to tell you to be on that higher, closer to that 60 end. Herpetic ulcers, here's the codes as well. Gingivitis therapy. These are all things that we can do in our practices. You can see here, prophies, again, typically we're doing mostly prophies. This is a case study from a practice. We want to reverse this. We want to get those numbers where we need to. We have opportunity to care and take care of patients. So by doing that, doctors and hygienists, even if you just enrolled conservatively 2 adult SRPs per week, periodontal therapy per week, and having laser assisted periodontal, and I'm doing this conservatively with having about a $700 per case total, which is very on the low end, you are looking at $70,000 a year in revenue, more than pays for your lasers, right? So definitely, again, look at where you are at in your practice today, and then what can you guys do to help incorporate lasers to not only take care of your patients, but make it a practice revenue builder as well. Again, you guys asked me before the program, Valerie, give us examples. What do these ROIs look like? And so here's LBR. If we just took some case studies here, if I had 8 patients in the chair for the day, worked 5 days a week, let's say only 50% of patients said yes, okay? The fee at a low rate of $50, which would be our average total, which would give us a potential annual revenue of $48,000. With LAPT, again, if we did, conservatively speaking, about 50% of our patients said yes to periodontal therapy. That's about 80 quads, let's say. Here's our average case fee. That could generate $192,000 to your annual production. So doctors, I know that is something that definitely can help you guys during this time, when especially being shut down and cash is king, and you're looking for ways that and additional procedures that you can do to help improve your cash flow in your practice and take care of patients, right? So it's a win-win. All right, so what's going to happen? Will our practices return to normal? Probably not, right? So this is our new normal. This is it. This is where we're at. We're continuing to learn, and the silver lining, like I said earlier, is that COVID-19, we can now move forward with our new norms safely with the PPE and technology that has allowed us to really help mitigate the risk while providing our patients the highest standards of care. So for many practices, things we should have already been doing, like those pre-procedure rinses, hygienists using HYVACs, really that's been since 2003 that it's been recommended, if we use ultrasonics, that we should be using HYVACs, and then these other things that we put in place. So let's see here, again, connecting the dots. Let's really go forward now in our post-COVID strategies. Let's connect the dots, the practices that give the comprehensive care, and connect the dots with that oral systemic health and educate our patients. Those are the practices that are going to survive and thrive, right? So our patients are expecting this from us. So let's commit to no more bloody prophies. Let's give our patients the care that they need and they deserve. Let's embrace technology. There's things out there, teledentistry is not going away. These applications are not going away. Patients are at home and they're connecting with us virtually using these apps. When they come in the practice, we have great technology available to help us be efficient, where we can gather a lot of data now in a short amount of time, right? So embrace the technology, and of course, help incorporate safety measures and a higher standard of care for your patients through, again, the technologies available through laser dentistry. My hope is that you will continue to be the passionate leadership healthcare professionals that you are. And, hygienists that are on the call, we are not cleaning ladies. We are not tooth janitors, right? Dentists on the call, you are not a tooth technician. We are invaluable members of the healthcare team. And it's now more than ever that we have an opportunity to make a difference and be seen as the oral health care specialists we are. Our time is now. And, you know, again, the most successful practices are those that are really taking the successful practices, taking these best practices that we've learned for the new norm, and have made that paradigm shift with comprehensive oral healthcare. You know, same day dentistry is another thing I wanted to mention to you as a strategy. You know, getting the patients in, reducing the PPE, they're already there. A lot of insurance companies now are allowing us to do a full mouth scaling and root planning versus before we had to have them come back because of our pandemic, because of COVID, get it done while we're there. So again, any questions you guys have, I invite you to connect with me. You can take a screenshot of this. This is my email. Connect with me on Instagram. Ask me questions. I'm here to help you today. And, you know, if you need resources for training, you want to get your hygienist trained, I've got more than a handful of colleagues I work with that are fantastic. I know Janet Press is one of our great colleagues that has a course coming up December 5th in Las Vegas. And then again, we have other colleagues that we can support. So email me and I'll get you those resources. And I will now turn it back over to Dr. Lau.
Great. Well, thanks, Valerie. And let me see if I can get my screen back up, which I think I can. That should be it. Correct. So,
All set, Dr. Finn. Looking good.
Perfect. Thank you, David. So we're going to finish up, and again, we're going to show you how you integrate lasers from both the hygiene aspect now into the dentist and specialist aspect, a little bit on the pediatric component of it. But being a periodontist, I also have to have a little bit of influence on the perio part. These are good examples of what we call all tissue lasers. These are erbium chromium YSGG lasers. There's also your erbium YAG lasers that are out there. And in addition to the soft tissue, the hard tissue lasers will work on teeth from cementum to calculus to dentin. From the tooth standpoint, they can etch. From a perio standpoint, they definitely can remove calculus. Dentin also etch. And from bone, from my perspective as a periodontist, we can do ostectomy, we can do osteoplasty, but we can also biostimulate bone, as Valerie was discussing with you about photobiomodulation, which is one of the most exciting areas for me right now. But let's get back to the COVID-19 arena. The one thing that all tissue lasers do is that they're slightly different from a diode laser. A diode laser, for the most part, will work off of thermal, with exception of probably laser bacterial reduction. But even the laser-assisted periodontal therapy, that's a curettage and is primarily more thermal, although it is pulsed and really should not be creating any adverse tissue events. But the all-tissue laser in the erbium works off of photoacoustics. And that photoacoustics is like creating a bubble, the bubble bursting, creating a shock wave. And these little mini shock waves is actually what actually ablates or vaporizes through the tissue and makes such a wonderful cut. For hard tissue, it literally takes the hydroxyl apatite and causes like a micro implosion within the hydroxyl apatite. So what we begin to find, though, was that if you actually were running water through the high-speed handpiece for what you would need to be for adequacy, and you ran the same amount, you ran water through a erbium laser, using it with what we consider to be default settings, there's actually 80% less water used in the laser. And then we went one step further. We started doing photography, and we found out that that droplet, that spatter for a erbium laser was so much less than for the high-speed handpiece. And then we began to do bench tests in which we looked, if you look at this over on the left and way over here, I think I get my cursor over here, that's the mannequin head. And this is like a bib. And over here, we're using our all tissue laser. This is the mannequin head. And then we would use the high-speed handpiece in the mannequin. And then we digitally actually measure the amount of droplets that came out of that versus the all tissue laser. And you can see how significantly decreased there is in droplets when you're using the all tissue laser. And that actually equates to about 98% less aerosol when you're using using an all tissue laser versus a high speed laser. So if that is the case, there is now a rationale for using a laser, not in lieu of the high-speed handpiece, but maybe adjunctively, and also from the standpoint, let's not forget, from a marketing standpoint. The last time I checked, we do need to create a niche in our practices. We are, in a sense, competing with each other. And so the way a patient decides one practice to the other, hopefully, is our charismatic being, our rapport, where our office is located, our team members, but also, as Valerie mentioned, our patients are also concerned with infection control. So if you have a technological device that actually can do the same procedure, but decrease the amount of aerosol, not only would you want to consider it, but if you do acquire it, you got to market it. So these lasers, they can treat everything. A crown lengthening, some of them have compact design. This is the Express. The other thing behind some of these lasers, look at the handpiece. The handpiece is almost identical to a high-speed handpiece, and it has the air, it has the light, it has the water. And so for access, they're phenomenal. And so let's take an example for tongue tie, for lingual frenectomies, including newborns. And I was told, and there's probably some oral surgeons on this call, but forgive me, but I was told by oral surgeons that if I ever did anything in the floor of the mouth when I was in dental school, that I would die, that I should never, ever touch the inside. But now, after 7 or 8 years, I've done hundreds and thousands of lingual frenectomies, and guess what? I didn't die. And they are just a wonderful device because of the hemostasis. And so now you see immediately right after doing a classic lingual frenectomy, it's the perfect diamond. These are very quick, very easy to do, good reimbursement. And then if we get into the lactation issues in pediatric dentistry, there are some pediatric dentists that are doing 500, 600, 700 newborns a year with these types of lasers. And so therefore, 1 week later, great granulation into the wound area, very little, if any, discomfort. Now, admittedly, when you do the lingual frenectomy, you do need to have tongue exercises or it will try to grow back. And so we have what we call the 10-10-10. So 10 times a day for 10 seconds for 10 days, right after the procedure, you have the patient try to touch their nose with their tongue. For babies, we use coconut oil and have the mom go up under the tongue so that we do not get any type of reattachment. But my goodness, the kinds of things that we can do with diode and all tissue lasers are phenomenal. This is not a simple one. This is where the frenum goes all the way through into the nasopalatine area. Here we release it, we bring it back through the diastema. And again, you see the result on the far right, which is approximately 3 weeks later. So the healing again is just fantastic with these. But what about hard tissue? And in many, many situations, in both adult and deciduous teeth, local anesthetic may not be necessary. For adult teeth, it is true that our class 3, 4s, and 5s are so much easier to do without anesthetic. Some of our incipient class 1s, buccal pits. Now, if you get into a really deep class 2, what I always call the redheaded 21-year-old female with caries on the pulp horn on 31, you better get out the septicane. But for many of these scenarios, the precision, minimal vibration, again, we go back to minimally invasive, the absence of smear layer by being able to etch at the same time. So these procedures are fantastic. Good cutting effect on root surface causes no burning or melting, like sometimes you see with our CO2s. And so we have people like Linda Merson, who a pediatric dentist in Colorado, who does substantial numbers of procedures on deciduous teeth with no local anesthesia for their patients. And so now it becomes to where what? Good patients refer good patients. I mean, that's just the way life is. We call it, I'm a Pankey faculty member, likes like is what Dr. Pankey always said. So, you know, your number one resource is patients. And it is true. I'm sure that a pediatric dentist can tell us that, yes, it can be very stressful, not just for the patient, but I think you could tell me that it probably is as stressful for the parent. But if you're telling them that there's a possibility with deciduous teeth, you're not going to be using local anesthesia. By the way, we've timed it. Local anesthesia probably takes about 5 minutes from start to finish. So if you can do these procedures without local anesthesia, you're decreasing the stress, but also you're probably creating your time efficiency, as also Valerie mentioned, that is somewhat interesting during these COVID-19 times. So here we can do pulpotomies, we can do frenectomies. The frenectomies I do with children under 6, I do with TAC 20. I do it with the super duper tax that I get at formulary, you know, at compounding formularies. I get it in different flavors, but they're just wonderful, wonderful, wonderful procedures to be able to do. And we mentioned this a little bit before. Some laser companies have become incredibly creative with monkeys and fish. I'm in Florida, so I would probably choose the aquarium one for my periodontal practice, and I'm sure my patients would get a kick out of it. But the bottom line too is there's actually there's been, by the way, a couple of studies with autistic children and using laser as far as making it a more comfortable and manageable situation. And so with that, we have some great procedures that we do. To me, this puts it all together. Here we have an old class 5. We're taking our laser to do the gingivectomy around the area so that we can get access. Now we're going to actually remove the composite because the composite has water and our erbium loves water. So we're removing our composite restoration. We're refining our prep with our laser. We're still using the same tip. Notice no bleeding. And we go ahead and prepare and do our new composite all in one appointment. And so therefore we trough with this. If you're into digital scanning, you know what you see is what you get. So troughing with the laser is just so superior, so clean compared to retraction cord. So as we finish, there's some many areas that we use our laser for. I rarely ever pick up a blade in managing periodontitis as a periodontist. I manage both moderate to severe periodontal disease. We have created very conservative, minimally invasive procedures in which we are reducing the inflammation, but also, as you see before and after on the radiographs, that we are also getting some osseous regeneration without actually doing osseous grafting. And so we're starting to see more and more and more of these regeneration before and after radiographs with the laser, because it's degranulating, decorticating as we do that. As we again begin to move into some closure, my goodness, for implants, for those of you out there that are doing your second stage uncoveries, you talk about emergence profiles. Nothing does it better than a laser. You're not using punch biopsies anymore. You're not using blades, but probably the number one area that our periodontists are seeking this laser out, and also our practitioners, dentists who place implants, prosthodontists who place implants. Unfortunately, we're starting to see some implantitis. And we're here to say to you that this laser is phenomenal. These all tissue lasers are phenomenal in being able to degranulate, decorticate, and literally start to turn around these implants that we've been removing, that we're having to trephine out, that we can now save. So we're really getting some very, very good response. We've got a couple of great case studies that have come out just in the last 3 weeks. We're using the new side firing tip to decontaminate the implant surface and begin to save these. And this is the example of one of these tips that we have. This is unique to this particular company. It is called the side firing tip. And you'll notice how the energy goes into the threads. You know, I began to wonder, how come we had so much implantitis, until it dawned on me, one of the reasons is that implantitis is like a furcation on steroids. So we're sitting around worried about a little class 2 furc on a molar. This thing is circumferential and completely around the diameter. But look at some of the results that we're getting. I mean, just some, and generally without any osseous grafting. So there has just become more and more versatility with that. Aesthetic standpoint, we're doing aesthetic crown lengthening. I did 3 of those today with patients. And I'm doing it to the point that I actually even have the patient hold a hand mirror when I finish, because there is no sutures, there's no bleeding. Every now and then someone says, well, can you make this one a little longer? You know, because I think they're like I'm in a Twilight movie or something. I say, okay, we can do that. So we're taking cases like this, we're treatment planning them, and we're making them look gorgeous. And we're doing this with aesthetic crown lengthening. This is Ricardo Matrani from the Spear Group. This patient came in to actually have veneers. And Ricardo practices a wonderful practice in Mexico City. He's using the laser to do recontouring. He's using a sapphire tip. Notice just this gorgeous recontouring on the laterals especially, and then recontouring the profile through the distal on the 8 and 9. He's actually going into the sulcus and doing some osseous surgery without reflecting the flap. And my goodness, what a result without the veneers. And so then he comes back and he adds that little icing to the cake with the whitening, and just such a wonderful, wonderful post-op result with this. Also to let you know, and this is not a novelty, we take off ceramic veneers in like 30, 40 seconds with this laser. And we also take off zirconium crowns, takes a little longer, not the 30 seconds, maybe about 3 to 4 minutes. But if you are a dentist out there, if you've cut these things off, especially the crowns, you know this is purgatory. I mean, this is 25, 30 minutes. Sometimes you don't even know where the cement ends and the tooth begins. But here again is Dr. Matrani. Look how these things come off as one piece. And the way this is working is the laser energy is going through the zirconium, through the porcelain. It doesn't care about it. It's looking for the target, and it's going for the resin, because the resin is what has the water. It causes micro implosions in the water, and these things just come off almost to the degree that you could put them back on if you desired. So again, this is one of my latest hotspots. Many referrals on this arena, and that is gum bleaching. And depending upon where you are, once folks know that you can do gum bleaching, I mean, it is out of sight. I mean, your phone will be ringing off the wall. But isn't it incredible how you can take a laser and literally go in and remove not just the melanin, but the melanocytes. And the point is, it will not come back. And this is a 4-week follow-up with this particular patient. And so just to let you know, we do use medicaments following these procedures. One of our favorite ones, if you're a laser aficionado, including in the hygiene chair, is using PERIOSciences. And PERIOSciences is just a wonderful gel that patients use after these procedures. You just put a drop on the tongue, move it around 2 to 3 times a day, and you can see just these extraordinary results even within 3 weeks. So we no longer use any chlorhexidine in the practices that I work with from a consulting standpoint. We only use this PERIOScience AO gel. This guy is still dipping. Sorry, but day 1 and 21 days after, still dipping 21 days later, too bad, with the tobacco nicotine pouch with stomatitis. But look at the changes. Now, that doesn't mean that he can still do this, but it does mean how anti-inflammatory it is. We'll still do a biopsy. So these gels are xerostomia, lichen planus, wound healing, you name it. But if I put it together, here's our patient coming in because of a lateral and they don't like the central. Here we're doing the laser procedures, gingivectomies, also using the gel and getting those results. You know, so as we talk about, Valerie did such a nice job on the return on the investment. We're not asking you to do things that shouldn't be done. We're asking you to find the things that are already there, but take advantage of it. And I must tell you, one of my pet peeves, would you stop doing things for free? Just because it takes you, you know, sometimes I do a frenectomy, it takes like with a baby, it probably takes like 10 seconds. Well, should I charge for 10 seconds? Are you kidding me? No, I'm going to charge $600. So, you know, but what this does is it gives you better scheduling. Valerie mentioned that. We need to do, let's face it, more procedures on one patient. We can't keep turning these ops over like this. I don't know if you know this, but to turn over an operatory in the state of Florida is $21. $21 and not do anything. $21. So, you know, you might not think this is in your arena, but I love it. Have fun. Professional fulfillment, but that wow factor. I mean, today when I did that aesthetic crown lengthening, I thought that 18-year-old post-ortho female, I thought she was going to start crying because it just was that wow factor, and that's what we want. So as Valerie and I put it together, she and I are strongly encouraging that patient safety is critical. By the way, and this was announced today at the ADA, it should make us all proud. You do know that there is incredibly low percentage of any dentists that have gotten COVID-19. You do know at this point in time, and I'm proud of this, there is not one single documented incident of COVID-19 transmission in a dental office. And my goodness, there's 100,000 dental offices out there. So we have been doing it right all along. Valerie mentioned she's been doing pre-procedural rinse way before it was in vogue. So we are saying, however, that if you're going to be using manual instrumentation, adjunctively use your laser to try to get the same result as with the ultrasonic. But go to that diode laser And if you're doing caries removal, perio removal, you might want to use your laser instead of the high-speed handpiece with a 98% reduction. So routine practice productivity is compromised, but now it's time, and Valerie said it so well. It is those practices that are efficient, that are charismatic. They're the ones that are not going to see an overall decrease in their production. Yeah, we're going to see a somewhat of a decrease, but we're going to overcome that. But she and I both believe that this laser technology is almost becoming the standard of care in what we do to get the patient results that we require as practitioners. So with that, David, I'm going to turn it back over to you. If we have any questions or where we want to go from here.
Thank you, Dr. Lau, and also to Valerie. I never failed to learn. I've heard you several times now each, and I learned something new every time. So thank you for sharing all of your experience, both clinically and otherwise, with the audience and myself tonight. We do have some questions, and we've got about 10 minutes or so to get to them. I think we'll get a chance to get through most, actually. You know, I'm going to start with one for you. Actually, Valerie, I'm going to start with you. There are some questions that come up with the studies that you referenced, and you referenced several, but you were mentioning the closest study, and there was a question about the reference there. I think it was about the rinses and effectiveness, et cetera. Is there anything more you can add to that for this particular audience member? And you might be on mute because I see you talking, but I don't hear you. I apologize.
Hi. So,
there you go.
So Closest did have a third-party laboratory tested on their rinse. There are other great rinses on the market too, right? So if you go to the ADA, they did that whole COVID packet, and the CDC based on their recommendations and guidelines. But there's a lot of information. You know, we've known that 1% hydrogen peroxide rinse, you know, has been effective with doing that pre-procedure rinse when the COVID pandemic started. You know, Closest is a chlorine dioxide based product. The iodine, the molecular iodine, is also shown to be a great product at reducing that in as little as 15 seconds in some of the things that I've read. So if you need additional resources for the Closest study, they have it on their website. For the others, you know, definitely check the resources at ADA and through the CDC. There's some great resources there. If you can't find it, reach out to me and I'll help you.
Yeah, great. Thank you. You know, maybe one more for you and then a bridge back to Dr. Sim, because the questions are kind of weaving in and out of both of your presentations. The other one for you, Val, is maybe just a quick review of where Epic X and Epic H might be used differently. You had talked about some different techniques and or procedures that you can do with one or the other. Can you give the audience a highlight again about Epic X versus Epic H, because you spoke about both?
Sure, absolutely. So great question. So the Epic X is, it's a 940 wavelength. So the difference between that and the Epic HYGIENE is 980. And that's where BIOLACE received its FDA approval. Now, someone from BIOLACE, if I'm wrong, please let me know. But that's where they did receive their FDA approval for that laser bacterial reduction, is at that wavelength. The other thing that the Epic X has that the HYGIENE one doesn't are those attachments. If you remember in my slides, I showed the attachment for the pain therapy, okay, for the type of pain therapy that you can do, as well as there's a whitening wand. So the Epic HYGIENE does not have those attachments to keep that cost, that price point low, so we can get it in the hands of the hygienist. One of the other things I didn't mention, because again, you know, with time, I was trying to hurry. But one of the things I love about the Epic HYGIENE laser is I shared it was designed by a board of hygienists. So we actually worked with the R&D, the research and development at BIOLACE, and said, hey, we need this handle lighter. We need this diameter fatter so it's comfortable. So, you know, the settings, the pre-settings. So, and of course it's purple because that's the HYGIENE color for the hygienist. We know that that's the HYGIENE color. So that's, you know, so again, it was a great, it really is a great tool or instrument to have in our operatory.
That's
Hope
great.
that answers the question.
I think so. And you were being modest. I was going to suggest to the audience that you were part of the panel of hygienists that helped us design it. So kudos to all of you for the hard work there. This is really a question for both of you, Dr. Sam and you, Valerie. You know, there's as we segue from the hygiene questions into maybe more the dentist questions, there's several references to states where hygienists cannot use diodes. And Dr. Sam, you're super influential in Florida, you know, having been a leader in the Florida Dental Association and, you know, position after position there. And I know that perhaps there's some change coming to Florida, but the question to both of you is, how would someone engage in a state where there presently is no opportunity for hygienists to use it? What should they do? You know, where do they start? How do they get people to start to support change in terms of diode use in the hygiene operatories? Sorry, clinical room.
So David, you mean from the standpoint of changing statutes and rules?
Correct. Those are the questions.
Yeah. There's actually, it's interesting in the business. There's three categories out there if you look at the 50 states. There's the states that actually have in their statutes and rules where lasers can be used by hygienists. There are states that have in their rules and regs where you absolutely cannot. And then most of the states, they don't mention it. So you're kind of caught in this quasi kind of thing of what to do. I would suggest in the states where it doesn't mention it, that you let the sleeping dog lie, personally. But in the states where it says you can't, you know, you always start with your board of dentistry. And because they're going to make that final decision. Rarely do these things ever get into the statutes. It's generally rules, unless the statute says there's no way. But it's just getting to know the folks in the board of dentistry. If it's going to be a statute change, then that's a whole different thing with lobbyists. And Valerie knows from Georgia. I mean, it's not an easy thing. I want to tell you that it's sometimes a 2 or 3, 4 year thing to be able to accomplish it. And so I just say, God be with you. You may want to think about doing some other things in life. You know.
Thank you, Sam. You know, as we then maybe segue into questions more specific to the dental applications, Sam, of laser technology here. This is from a pediatric dentist, and I'll pose it to you. For us pediatric dentists in the audience that would utilize the laser for TOTS, pathology, and hard tissue procedures, why water lasers? Why the laser that you talked about, Dr. Lau? What's the advantage to that over other types of lasers?
I think the specific advantage is versatility. And I don't really want to speak to like BioLace. I much rather speak to erbium chromium YSGG. That particular wavelength is absorbed more in water than the erbium YAG. For me personally, it's just the periodontist in me. I like precision. With the erbium laser, I know that the energy is 1 to 1.5 millimeters. So I know exactly where that energy is going. For me, for the lasers that are like CO2 lasers, in my mind, I can't guide them as well because I can't really determine their targets as clear as I can with an erbium laser. So to me, it's not necessarily about water lace, it's about the appropriate wavelength. And I've used them all. When I was a grad director, I get them all free. But it really is the versatility of being able to use the laser and being able, if you talk about newborns, dialing down the water. I mean, I've done my share of newborns. One of my good friends is a periodontist in Fort Lauderdale. Kenny Levine does 30 newborn frenectomies a month, and he's done over 5,000 of them with the erbium chromium YSGG. So in my mind, it really comes down to multiple uses of it, being able to do around like even a class 5, the GV that we showed, removing the composite and then turning around and then etching and then replacing it.
Thank you, Dr. Lau. And just in interest of time and recognizing we've got a few minutes left, I'm going to amalgamate a number of questions, probably more than 10 that I can count, around your mention of pigmentation in the gingiva and how a laser might be effective against that. Could you just maybe recap that? There's confusion on what to call it and what it is and how to do it, et cetera. So, you know, obviously recognizing we have a couple minutes left, but could you go back over that and kind of steer us there a bit, please?
It's called, yeah, and yes, you can see by the number of questions, it's really, really, really caught on. You know, there are folks that call it gum bleaching. I kind of don't like that. I'd rather call it gingival depigmentation. By the way, we have Dr. Berger and I have a great article on that in Dental Town. So if you put my name in or Dr. Berger's name in, you'll get actually before and afters and the settings. But these procedures for depigmentation are just so, I don't want to say easy to do, but they're very straightforward to do. There's very little, if any, adverse effects. It takes me about 45 minutes to do an arch with depigmentation. But if you do it well, because see, there's no hemorrhage, you don't get splotches that you see in other depigmentation procedures. You're able to really isolate the melanocytes and really remove them to the depth through the connective tissue. And you'll be literally shocked at how that depigmentation, the melanocyte, the melanin is completely gone. You know, in the next month, it is as pink as it can be, blending into the gingiva. So it's just a wonderful, wonderful procedure to do. You have to be careful though, because once folks know that you can do it, you're going to get a lot of referrals on peer-to-peer.
Excellent. Thank you, Dr. Lau, and thank you to both our panelists. I'll be able to sort of close this here in just a minute or two. Before I get to see instructions and some of the wrap, I just wanted to once again thank Dr. Samin Zarabi for inviting us and both of you to speak tonight. Dr. Zarabi, any final comments, anything before we wrap it up this evening?
I just wanted to thank you, David and BioLace, for putting this event on, and thank you so much to our speakers. I know it's late where you guys are, so thank you, and also for all of your expertise that you shared tonight.
Excellent. Thank you, Dr. Zarabi, for having us.